What types of dialysis are available for people with end-stage renal disease, ESRD? Hemodialysis and peritoneal dialysis, PD. How long has dialysis been in use? Since the middle of the 1940s, hemodialysis and peritoneal dialysis have been used. Dialysis was first used regularly as a treatment in 1960, and it is now a common practice all around the world. In 1976, CAPD was established. These therapies have benefited thousands of patients. End-stage renal disease requires dialysis or a kidney transplant to survive. What is dialysis? Dialysis is a treatment that performs some of the functions of healthy kidneys. When your own kidneys are unable to meet your body's needs, you will need it. What is the purpose of dialysis? Dialysis keeps your body in balance when your kidneys fail through removing waste, extra salt, and water to prevent them from building up in the body, and by maintaining a safe level of certain chemicals in your blood, such as potassium, sodium, and bicarbonate, which helps control blood pressure. When is hemodialysis necessary? Dialysis is recommended by the National Kidney Foundation when you reach end-stage renal failure, which typically occurs after you have lost between 85 and 90% of your kidney function and a GFR 15% or less, or if you have severe symptoms caused by your kidney illness, such as shortness of breath, exhaustion, muscle cramps, nausea, or vomiting. How long can you live on dialysis? The average life expectancy on dialysis is 5 to 10 years, but several patients have survived for 20 or even 30 years. Discuss with your healthcare staff how to take care of yourself and stay healthy while on dialysis. How often is dialysis required per week? Hemodialysis, HD, 3 times per week is the recommended treatment option for patients with end-stage renal failure, ESRF, whose uremia cannot be managed effectively anymore. Dialysis types, which is best for you? Dialysis is classified into 3 types: in-center hemodialysis, home hemodialysis, and peritoneal dialysis. Each form has advantages and disadvantages. It's crucial to note that even if you choose a form of dialysis, you may always change, so you're not locked into any one type. A given form of dialysis may not be appropriate for you due to medical, health, or lifestyle reasons. Learn about each type and consult with your healthcare provider to choose which is best for you. What is the other type of dialysis for ESRD, end-stage renal disease? Peritoneal dialysis, PD, catheter in belly. How is peritoneal dialysis, PD, unique? By employing the body's own abdominal lining, the peritoneum, as a filter rather than a synthetic one, PD distinguishes itself from other types of dialysis, dialyzer. If you decide on PD, you will require surgery to implant a PD catheter through your belly. Peritoneal dialysis advantages. PD is something you can do day or night while you sleep. There is less potassium accumulation in the body, more mobility and flexibility. PD diet differs. You may need more protein. Visit your dialysis center typically twice a month for checkups instead of several times a week. Fewer side effects. PD patients may experience fewer dialysis side effects, such as muscle cramps and unstable blood pressure. No needles. PD does not require the use of needles and instead uses a soft flexible catheter in the belly to access the peritoneum. Better preservation of remaining kidney function. Peritoneal dialysis disadvantages. No days off, performed every day. Catheter could have an impact on how you feel about yourself. In some cases, bathing and swimming may be restricted. Dialysis fluid containing glucose, sugar, has the potential to cause weight gain. PD patients lose more potassium through daily treatments and through their urine if producing it. At home, there must be room for supplies and liquid. The catheter may become infected, especially if proper infection control protocol not followed. What is the outcome of home hemodialysis? Home hemodialysis may be associated with a higher quality of life, despite the fact that in-center, 3 times per week hemodialysis is more common. increased happiness, reduced symptoms with less cramping, headaches, and nausea, improved energy levels and sleeping patterns. Home hemodialysis advantages. According to studies, receiving dialysis at home 4 to 7 times per week results in much better outcomes overall, including a longer lifespan and higher rates of survival. You both get experience performing treatments without the assistance of the professionals at the dialysis center. You can perform dialysis in the comfort of your home. There is no need to travel to a dialysis facility 3 times a week, giving you more freedom to choose a convenient time to perform dialysis. Greater sensation of control as a result of independence and self-treatment. Home hemodialysis disadvantages. You must have a dialysis partner with you while receiving treatment. You must take time off from work or your regular schedule in order to attend training with your dialysis partner. There must be room set aside in the house for the machine, a water system, if necessary, and supplies. Plumbing and electricity may need to be special. No medical personnel are available at home to oversee the course of treatment or respond to urgent inquiries, although you can call the center at any time and go to the center periodically to be checked. In-center hemodialysis advantages. All parts of treatment are handled by trained personnel. Some tasks, like inserting the needles, you might be able to complete on your own. Since others are dialyzing concurrently, relationships and camaraderie may grow. In-center hemodialysis disadvantages. The center sets the day and times for treatment. You must make at least 3 weekly trips to the center. You have less privacy because other people are having dialysis at the same time as you. During treatment, loved ones cannot be by your side. There may be restrictions on what you can eat and drink while receiving dialysis. Is temporary dialysis possible? Unless you are able to receive a kidney transplant, if you have ESRD, you will require dialysis treatments for the rest of your life. In the event of acute renal failure, dialysis might only be required temporarily while your kidneys recover. When your kidneys cease functioning suddenly and briefly, you have acute renal failure, usually 2 days or less. Your kidneys may function normally if the acute renal failure has been treated. Does dialysis hurt? The insertion of the needles into your fistula or graft may cause you some discomfort, but most patients experience no significant issues. Dialysis itself does not cause pain. Before and after treatments, many patients experience fatigue and weakness. Some people, however, can experience a blood pressure drop. If this occurs, you might feel queasy, throw up, have a headache, or get cramps. As you receive treatments more frequently, these issues typically disappear, although some people may continue to experience consequences. Who makes up the dialysis care team? Nephrologist. Your nephrologist is your kidney doctor. A registered nurse with special training in caring for renal patients. You may have a nurse practitioner, NP, physician assistant, PA, or both on your care team. Renal dietitian can help you meet your specific and unique food needs. The dialysis technician starts your dialysis treatment at each session. Social workers play many different tasks, including supporting your family's emotional, behavioral, and mental health. Do you need to stick to a certain diet and hydration schedule? In-center hemodialysis. Given the longer intervals between treatments, you must rigorously restrict your intake of potassium, sodium, phosphorus, protein, and water. Peritoneal dialysis, PD. You could stick to a diet that restricts salt and phosphorus. Due to the more frequent PD treatments, you may need more protein and potassium. However, this diet may be less restrictive than the one for in-center hemodialysis. This implies that you might have a little more leeway in terms of what you consume. Home hemodialysis. If you perform your treatments daily, you might be able to ease the strictness of your meal plan. What do you need to do to prepare your home for peritoneal dialysis? You will require a sizable, clean, dry location to store your equipment in addition to a clean, dry area that is free of pets and plants where you can receive treatment. Need training to learn how to do your treatment. For home hemodialysis, along with storage space, you could need plumbing and electrical work. You and your partner need training to learn how to do the treatment. Need support at home? How exactly does hemodialysis or peritoneal dialysis, PD, work? Hemodialysis. To obtain a vascular access, arm AV fistula, AV graft in thighs or groin, and chest catheter, you will need to have minor surgery before you may start receiving hemodialysis. This allows your blood to enter and exit your body and travel to the dialysis machine. Hemodialysis involves the passage of your blood through tubes from your body into a dialysis machine. While your blood is in the machine, it travels through a dialyzer, a filter that cleans your blood by removing some waste and surplus fluid. Your body then receives the cleansed blood through tubes from the dialysis machine. A dialysis technician will use the vascular access to insert 2 needles into your arm at the beginning of each hemodialysis session. From your vascular access to the dialysis machine, your blood will pass through 1 needle. From the dialysis machine, it will pass through the second needle and return to your body. Peritoneal dialysis, PD. In order to provide an access, the doctor will insert a catheter, a thin plastic tube, into your abdomen, belly. Through the catheter, dialysate is gradually injected into your abdominal cavity, also known as the peritoneal cavity. During the course of the procedure, the blood remains in the peritoneal cavity's arteries and veins. Your blood is drained of extra fluid and waste products and put into a solution called dialysate. PD can be done at home during the day manually. Continuous ambulatory peritoneal dialysis, CAPD, and automated peritoneal dialysis, APD, at night while you sleep. What do the vascular access team do? A vascular access team will perform the procedure to place your vascular access, which will connect you to the dialysis machine, if you are receiving hemodialysis, whether at home or in a facility. A surgeon, a radiologist, a medical professional who reads X-rays and other body scans, and a vascular access coordinator are typically on vascular access teams. In order to ensure you have the proper kind of vascular access for your treatment, the coordinator will discuss your medical history with you in collaboration. Why is dialysis performed for 4 hours? Toxin removal requires 4 hours of dialysis. More importantly, when combined with a sensible sodium intake, 4 hours of dialysis provides an adequate time for excess fluid volume to be removed without causing uncomfortable dialysis symptoms. Are you able to go on vacation? For in-center hemodialysis? Yes. Locate a dialysis facility close to your trip and make appointments for treatment sessions well in advance. A copay for out-of-state dialysis may apply. For peritoneal dialysis, PD. Yes, you can do your treatments in any clean, dry place. Usually, you can ship your supplies to your travel destination. For home hemodialysis. Yes, you may typically bring your machine along. You will also need a trained care partner to help you with each treatment. How can you pay for dialysis? The majority of the costs of dialysis are covered by Medicare, Medicaid, and many private insurance programs. The majority of dialysis patients can enroll in Medicare at any age. You might need to wait a few months before your insurance starts paying for the treatment you select. Additionally, you might have to cover certain out-of-pocket expenses like deductibles or copays. Find out more about how Medicare covers dialysis. The American Renal Fund, AKF, might be able to assist you if you have kidney failure and are unable to pay for your treatment-related expenses. Patients who can prove they are in need of assistance can apply for grants through the AKF. Find out more about the financial aid provided by AKF. Call your insurance provider or consult your social worker if you have any queries concerning the expense of dialysis. Disclaimer: this is for informational purpose only. Please speak to your healthcare provider if you have any concerns. Thank you for watching. Please like, share and subscribe at Rosieland channel.